Welcome back. We are joined today by Surinder Gill, who is the Assistant Pharmacy Manager at London Drugs, and Amanda Manholt, the Cosmetics Manager. Great to have you guys here.
Good to be here.
Yeah, we're talking about eczema today, or dry skin in the winter. It's something we all suffer from, or a lot of us do. I'm one of them. I have a heavy case of eczema right now, and it can get really bothersome, as you guys know.
Yeah, and it doesn't even have to be something as like a diagnosed eczema. It can just be that winter itch. So, you know, we'll see it on infants and little kids too. You know, they're scratching at night, they're not sleeping very well, right up to full-blown eczema.
Right. So, Surinder, you have some knowledge in this department.
Yeah, and we work hand in hand with cosmetics as well to get the right product for the right person. You have to remember that everybody has a little bit of a different approach to things. When we deal with products, we have moisturizers all the way down to, and that's the key of eczema, is trying to get the moisturizers in well before the eczema flares up. The biggest challenge sometimes is that once it's under control, everybody tapers off their moisturizers, but at this time of the year, it's very dry. There's zero humidity almost in some places. Their furnaces are going, the heating's going. So everything just starts to crinkle right up, like your hands get dry, splits and cracks. And the bigger challenge being that, what about the use of corticosteroids then? When is the right time to introduce that? We try to have a baseline of moisturizers, and sometimes that controls things, and sometimes it doesn't. So then how do you appropriately start up on a corticosteroid and the time that you're going to use for it?
Would it be fair to say that some treatment lines, for example, prescriptions, you can use them for a while and your body starts not desensitizing to their effectiveness, for example? Because I have cracks in my skin. I've used prescription, it works for a while, it stops working. Then I find something like Aveeno, eczema care, that works better. It's weird how certain things work for a time and then you have to move on.
I think the biggest thing that you want is you have to personalize your therapy, and just remember everything that we talk about here, we're talking broad-based, but when you look at patient care, it's about individualizing what works for you. So somebody might start on a product that worked really well for a while, you're right, or a cortisone-based cream worked really well for a while, and there's some mild ones you can get without a prescription. And then you move on to ones that are a prescription, and sometimes the challenge is how much do you use of it, too.
Exactly. And do you use it like a hand lotion or only on the affected areas? I'm using it right now like a hand lotion. I'm not going to lie.
So we're going to teach you a little quick trick here. Actually, it was one that I coined with, or I didn't coin it, Dr. Lewis, actually, our local dermatologist coined it, is a rice to toonie ratio. This is a toonie, and to cover the size of a toonie, you just need a grain of rice. So if you're covering this big of an area, you just put a little grain of rice of the cream on there and spread it on there. And that would give you a proper ratio for your use of a corticosteroid. And it's easy to remember, rice to toonie, so it's one of the best ways. How frequent and how long you use it depends upon the corticosteroid. There's some medium potency ones that you might want to use up to 2 to 3 weeks. Once it gets it under control, you stop using your corticosteroid.
Okay. What about some of the other products here? I take it most of these are over-the-counter. A good place to start if you don't want to hit a heavy steroid.
Absolutely, and it's sometimes a challenge to get in to see physicians. Obviously, we're all challenged in healthcare professionals, but you've got, Aveen's got a really nice product that's worked well with some of the patients I've dealt with, and it moisturizes really well. There's different body parts, obviously, that need a little bit more hydration than others, and you'll find that, you know, there's a hand cream that we have at the front.
Yeah, you should try this one, actually, Susan. This is a sickle fate hand, and this works really well, I find, for people with cracked fingertips. I see a lot of that this time of year. It helps sort of heal those little fissures, and also, again, where you have that broken open skin.
The good thing about the size of when you're carrying it, you're always washing your hands at this time of the year, so when you're washing your hands, it's handy to pull out, and that's when you want to hydrate skin, is when it's wet. So as you're coming out of a shower, that's the key to grabbing a balm and putting it on and moisturizing and trapping that moisture in there.
The trick, though, is in this age of the season of being sick and washing your hands all the time, it's a real struggle
to keep it moist.
I remember my grandfather used to wear gloves up to his elbows all the time to keep the moisture in, and I haven't gotten there yet, but if you notice me on the show with the gloves on, you'll know why. Maybe we'll get some nice trendy gloves. But you know what? I'm not alone. I know that. So many people suffer from this, and I think what it is about being militant and continuing to apply.
Yeah, it's just what Surinder said. You need to have a good regime, and also bathing too. You don't want to do something that's like, I know we all love our body washes. Maybe you got some in your stocking for Christmas, and that's great. But sometimes they're a little bit they have too much of a surfactant. They lift out that natural moisture.
Right.
So there's lots of options. There's cleansing oils, there's cleansing gels, there's cleansing milks, but there's things on the market. These are from La Roche-Posay, which is a great dermatological line from France. Yeah. And they will cleanse your skin, but they won't get rid of that natural moisture factor.
Which is excellent.
Yeah, and then of course when you get out of the shower, something like this one here, the Lipicar Balm AP, is a brilliant moisturizer. It also addresses the itch. And again, with children, that's a real issue.
It sure is.
As well as the Xericon from Aven. They have two different formulas, textures. They've got a balm, which is a bit heavier, and they have a cream, which is a bit lighter.
Excellent.
And then real quickly, dry lips. Everybody right now has got chapped lips. This Rock Lip Chap, we've got this little duo right now. They're like $10. I sell this to everybody, men, kids. My kids have them in their backpack. Just heals those lips up quick.
Awesome. We're out of time. Have to say goodbye. Surinder Gill, sounds like you know what's going on with the dry skin, so thank you for being here.
Thank you for having us here.
Yes, if you would like to go and talk to Surinder, of course, down at London Drugs in Lansdowne Village, you can go and bend his ear about the eczema problems in your life, like I have in my life. We're back in 90 seconds. Stay with us. Welcome back. Quick last segment talking with Amanda Manholt about how to choose the right cover-up, the right foundation.
Yeah, you know what, it's probably the #1 question I get at the store. People are a little bit lost, and granted, there's a lot of products. So very quickly, one of the first questions I'll ask is, are you looking for a powder coverage or are you looking for a liquid? Powder coverages, a lot of people shy away from them. They think it's going to be cakey and settle into the lines and such. But if you haven't tried powders in a while, they're amazing. So you've got triple, quadruple milling that makes the textures very small.
Good.
This dual finish from Lancome is a beautiful product, covers full coverage. You can use it wet, dry. This one from Imani is a vegan product, no gluten, no paraben, no talcs, no petrochemicals. So there's lots of great lines out there. If you want something more in a liquid base, then we're talking about coverage and finish. So it isn't all just color, right? So something like the BB cream, this has got to be one of my absolute favorites. So I was going to point, but anyways,
yeah, that's
BB
good.
cream.
Yeah, BB cream.
This one has beautiful coverage. So it's like if you took a moisturizer and a foundation, blended the two together. I love it on a mature skin. It gives a dewy, radiant finish. It doesn't look heavy.
Yeah.
Next, then you move into the liquid makeups. So something, I just brought some from Lancome because they've got a good selection. As you can see, not in finish, but in color. They've got some pretty incredible color range. Something like this one here, the Tante Mirac, is a beautiful lightweight finish. Again, gives that dewy, radiant look to the skin if you have a drier skin, perhaps. Then we have something like this, the Tante Dole 24. This is more for somebody with an oilier skin, somebody that wants real heavy coverage to hide all those imperfections, maybe if you break out. And then they go into this one, which this is one of my favorites too. This is the Renergie. This is the one I use. It's an anti-wrinkle, lifting, firming.
It does the whole thing.
You betcha. So if you've got more of a drier, mature skin, it's lovely.
Okay.
And then right down to the very end, this is a product from Vichy called Derma Blend, and it's amazing. It has the highest percentage of pigment in the product. So really that's what sets apart the coverage.
Yes.
You can use it for full application, or a lot of people will use it maybe in conjunction with their tinted moisturizer. If they've got a sunspot or something they want to really cover, you can just dab it on with your fingers.
Nice. Excellent options. A fast segment to be sure. Thank you for being here.
Thanks for having me.
You're very welcome. If you have questions about this, londondrugs.com. Of course, go and visit Amanda down at the cosmetics counter. She is a wonder and she knows her stuff, and there's some great products
Happy
here.
to help.
Yeah, thank you. Happy New Year to you.
Happy New Year.
Thank you.